Gerontology. Gerontology is the scientific study of old age, the process of aging, and the particular problems of older people. Geriatrics. Geriatrics is the branch of medicine or social science that deals with the health and care of older people. It is a specialty that focuses on the health and care of elderly people. So geriatrics is the branch of. EKG. EKG is electrocardiogram or electrocardiography. It is used to see how the heart is functioning. It mainly records how often the heart beats, how regularly it beats, and it gives us important information about possible narrowing of the coronary arteries and possible heart attack or regular heartbeats, like arterial fibrillation. Anyway, EKG, electrocardiogram. Embolus. Embolus is a blood clot that forms in a blood vessel in one area of the body, breaks off, and then travels to another area in the body in the blood is called an embolus. Embolus. An embolus can lodge itself in a blood vessel. This can block the blood supply to a particular organ. So embolus is a blood clot that travels. MRSA is MRSA. MRSA is methicillin-resistant Staphylococcus aureus. So it is a bacterium with antibiotic resistance. Methicillin-resistant Staphylococcus aureus is a group of gram-positive bacteria that are genetically distinct from other strains of Staphylococcus aureus. MRSA is responsible for several difficult-to-treat infections in humans, and it caused more than 100,000 deaths attributable to antimicrobial resistance in 2019. MRSA, MRSA, methicillin-resistant Staphylococcus aureus. Microbe. A microbe is a microorganism, especially a bacterium causing disease or fermentation. A microorganism or a microbe is an organism which is microscopic, means so small that people cannot see them with the naked eye. The study of microorganisms is called microbiology. Microorganisms include bacteria, fungi, archaea, protozoa, viruses, and are among the earliest known life forms. So microorganism is a microbe. Pathogen. A pathogen is a bacterium, virus, or other microorganism that can cause disease. Pathogens are disease-causing microorganisms, and they're different kinds such as viruses, bacteria, fungus, and parasites. So pathogen is a yucky germ. The pulse ox. So the pulse oximetry is a non-invasive way to monitor oxygen saturation. It shows the percentage of oxygen in the blood. A normal level of oxygen is usually 95% or higher, and the oximeter goes anywhere where it can see through your skin and read your blood. So like most commonly fingertips without nail polish. So pulse oximetry, it measures the percentage of oxygen in the blood. Glucometer. The glucometer is a glucose meter. It's a device for determining the approximate concentration of glucose in the blood. Axillary temperature. The axillary temperature is taken in the armpit, and an axillary temperature is lower than one taken in the mouth, rectum, or ear. It's because the thermometer is not inside of the body, such as under your tongue. So axillary is armpit temp. Macro. Macro is a prefix, so the beginning of a word, and the meaning is large or long. Macro, so like macrobiotics, macrocephaly, macroglossia, macrobiotics. Macro is a prefix and it means large or long. Macro. Macro is a prefix, so it's the beginning of a word, and the meaning is large or long. So like macrobiotics, macroencephaly, macrocytic. So macro is a prefix which means large or long. Micro. Micro is also a prefix, so the beginning of a word, and its meaning is small. So microsomia, like that's small body. Microcephaly, small head. Microbiotics. So micro is a prefix which means small. CMS. CMS is Centers for Medicare, so it's Medicaid services. CDC stands for Centers for Disease Control and Prevention. So CDC, Centers for Disease Control. OSHA, OSHA. OSHA is the Occupational Safety and Health Administration. They are responsible for ensuring safety at work and healthful work environment. So OSHA, Occupational Safety and Health Administration. MDRO. MDROs are multi-drug resistant organisms. FDA. The FDA is the Food and Drug Administration. VRE. A VRE is vancomycin-resistant enterococci. So, antibiotic resistance occurs when the germs no longer respond to the antibiotics designed to kill them. If these germs develop resistance to vancomycin, an antibiotic that is used to treat some drug-resistant infections, they become VREs, vancomycin-resistant enterococci. Metastasis. When something metastasizes, it is cancer cells that are breaking away from their primary site and traveling through the blood or lymph systems to form new tumors at other sites of the body. So they travel around and spread. Metastasis. CP. CP stands for cerebral palsy. So cerebral means having to do with the brain, and palsy means weakness or problems with using the muscles. Cerebral palsy, CP. Dementia. Dementia is the loss of cognitive functioning, such as thinking, remembering, and reasoning, to such an extent that it interferes with a person's daily life and activities. Some people with dementia cannot control their emotions, and their personalities may change. Dementia is the loss of cognitive functioning. Direct question. A direct question, it focuses on certain information. Requires yes or no answers kind of a question. For example, are you hungry? Direct question is a yes or no question. Open-ended questions. Open-ended questions invite the person to share their thoughts, feelings, and ideas. They can encourage conversation. So, example, what would you like for lunch? And then they have to actually answer, and then you can keep it going. So open-ended questions are not yes or no. They are encouraging them to have a conversation. Disability. Disability is any lost, absent, or impaired physical or mental function. It may be temporary or permanent. So So disability is the loss or absence of, or impairment of physical or mental function. Confabulation. Confabulation is the creation of false memories. They are filling in gaps that are memory loss bits in their stories, and they fill in the gaps through creating false memories to disguise the fact that they don't know where they're at in the story anymore. So confabulation is the creation of false memories to fill in empty gaps. Ectomy. Ectomy is the surgical removal of something, so like lumpectomy, tonsillectomy. Ectomy is the surgical removal of something. Heimlich maneuver. Heimlich maneuver is the manual application of sudden upward pressure at the upper abdomen of a choking victim to force a foreign object from the trachea. So the Heimlich maneuver is performed in an emergency treatment for obstruction of the airway in adults. It may be needed when someone chokes on a piece of food somewhere out and about in the world. So Heimlich maneuver, manual application of sudden upward pressure at the upper abdomen of a choking victim to force a foreign object from the trachea. Diaphoresis. Diaphoresis is a medical term for perspiration or sweating. It usually refers to unusually heavy perspiration. Hyperhidrous pertains to sweating excessively and unpredictably, usually as a result of overactive sweat glands. But diaphoresis is perspiration and sweating. Arteries. Arteries are a blood vessel that carries blood from the heart to the tissues and organs in the body. Arteries. Veins. Veins are a blood vessel that carry blood to the heart from tissues and organs in the body. So they carry blood to the heart from the other tissues and organs in the body. Contracture. Contracture is a permanent shortening. It's muscle tendons, scar tissue, producing deformity or distortion. Contracture, a permanent shortening. Bilateral. Bilateral is affecting both the left and right sides of the body. So like bilateral arthritis will affect joints on both the left and the right side. Bilateral, both left and right. Brady. Brady is a prefix, so the beginning of a word, and its meaning is slowness. So like bradycardia is slow, heart rate less than 50 beats per minute. So Brady means slow. Tachy. Tachy is also a prefix with the meaning rapid or swift. So tachycardia is rapid heart rate. Tachy is a prefix that also means rapid or swift. Systolic. Systolic is the upper number in a blood pressure measurement. It measures the maximum arterial pressure during contraction of the left ventricle of the heart. So the blood pressure when the heart is contracting. The systolic is the upper reading. Diastolic. Diastolic is the bottom number in a blood pressure reading. It measures the pressure in the arteries when the heart rests in between beats. Melena. Melena is the passage of black and tarry stools. So black stools. Hemorrhage. To hemorrhage. That is the loss of blood from damaged blood vessels. A hemorrhage may be internal or external and usually involves a lot of bleeding in a very short period of time. Hemorrhage. Loss of blood from damage. to blood vessels. Dyspnea. Dyspnea is shortness of breath. It is difficult or labored breathing, often a feeling of suffocation, and it can signal serious disease of the airway, lungs, and heart. So dyspnea is difficult or labored breathing, shortness of breath. Dysuria. Dysuria. So difficult or painful urination. It is some discomfort or burning with urination, usually felt in the urethra or the surrounding genitals. Dysuria. So dys and uria is urine. Difficult or painful urination. Dysphagia. Dysphagia is difficulty swallowing. Dysphagia, difficulty swallowing. Dysphagia. Dysphagia. This one is with the S, not the G. So the dys is difficulty. So it is difficulty speaking and understanding language. It affects how you speak and understand language. People with dysphagia might have trouble putting the right words together in a sentence, understanding what others say, reading and writing. Dysphagia, difficulty with language. Aphasia. Aphasia with an A. So A for me means absence of. So the loss of the ability to communicate, speak, and understand language. It's a condition that robs you of the ability to communicate, and it can affect your ability to speak, write, and understand language. Aphasia, the absence of communication. Hematoma. Hematoma, it's basically a blood blister. So a hematoma is usually caused by a broken blood vessel that was damaged by surgery or an injury. A collection of mostly clotted blood that forms in an organ, tissue, or body space. So it's localized swelling filled with blood. Hematoma, a blood blister. Decubitus ulcer. A decubitus ulcer is a bed sore, a pressure sore skin ulcer that results from prolonged pressure on one area of the skin without relief. So it's essentially the main cause of decubitus ulcer is prolonged pressure. Lying on a certain part of your body for long periods of time causes skin to break down. Areas that are especially susceptible are hips, heels, tailbone, and back. So all of the bony ligaments, knees, everything that has thinned skin areas that come together. Heels touching the end of the bed is a big one. So decubitus ulcer, it is a ulcer that is formed from prolonged pressure without relief. Orthopneic position. The orthopneic position places the patient in a sitting position with an overbed table in front to lean on and several pillows to rest them on. Orthopneic or tripod position is useful for maximum lung expansion. Orthopneic position. Inpatient care is when you are admitted to the hospital. Outpatient care. The patient receives care and then goes home. Assessment. An assessment is an evaluation of a patient's condition by a physician, nurse, or other healthcare provider based on clinical, laboratory data, medical history, and the patient's account of symptoms. The process by which a patient's condition is appraised or evaluated. Assessment is an evaluation or appraisal of condition. cc's in an ounce. There are 30 cc's in 1 ounce. 30. Ombudsman. The ombudsman is a person who acts on behalf of the patient as an advocate or a go-between. So the ombudsman is a patient advocate. Peristalsis. Peristalsis is the rippling motion of the muscles in the intestines that alternate between contraction and relaxation. And that is how the contents are propelled onward. So it's a series of wave-like muscle contractions that move food through the digestive tract. Peristalsis. The MAR, M-A-R. The MAR is a medication administration record. It's used to document medications taken by each individual and results. EHR. EHRs stands for Electronic Health Record. It is a computerized charting, it's permanent, and it's a legal document.